Hello there, I'm Neil Mortensen. I'm chair of the charity Occtopus, Oxford Colon Cancer Trust. We raise money for research, education, training, and raising awareness of colorectal cancer, Crohn's disease, and colitis. I'm here today in the Royal College of Surgeons in London. I've previously been the president here until recently. I was president for 3 years, and prior to that, I've been a busy colorectal surgeon in Oxford. Now, this month is Bowel Cancer Awareness Month, and I thought it would be really interesting for us to talk a little bit about why bowel cancer happens and how it seems to be becoming more frequent, particularly in one age group, which we might talk about in a moment. I'm absolutely delighted to welcome Chris Van Tulleken, celebrity doctor, and you may remember back around 2011-12, he had with his brother a great program called Operation Ouch, and most recently he has published a book called Ultra-Processed People, all about ultra-processed food and the effect it might have on us, and a series of what I thought absolutely brilliant Royal Institution Christmas lectures just at the turn of the year. So, Chris, a very warm welcome. Thank you very much for coming and joining us today. And I wonder if you can tell everybody, how did we first meet?
Well, I'm very honoured to be here because you were my tutor, a surgical tutor, about 25 years ago when I was a medical student in Oxford. So it's peculiar to come here and be asked questions by you.
And what happened then? After you didn't take up surgery anyway.
Well, I did. I did surgical training for 3 years, and then I realised I loved everything about surgery, but I would not have wanted me as a surgeon. I'm not a meticulous, organised, checklist-orientated, detailed person, and so I moved to being a physician. So now I'm an infectious diseases specialist, and I'm an academic at UCL, and I study food and nutrition, and I work with the World Health Organization about this. I'm not just a kids telly presenter.
So what particularly about food and ultra-processed food took your attention?
So I, as an infection doctor, as a young infection doctor, I worked in complex emergencies in very low-income countries, in Central Africa, West Africa, in South Asia, and saw a lot of kids dying of infectious diseases. But while the proximate cause of their death was a virus or a bacteria, the deeper cause was that they were being often marketed baby foods that their parents couldn't afford, and they didn't have clean water to make up. And if you make up baby food using water that has sewage in it, it doesn't matter how many antibiotics you have, the child is going to get very sick, and they often died. And so that gave me an interest in what we call the commercial determinants of health, how big industries affect our health. And I think globally, we can look at a handful of industries, fossil fuels, alcohol, tobacco, food and gambling, as being some of the leading causes of sickness and death in our world. So my expertise is really infant nutrition.
And just because I'm interested in the commercial side of food production, do you think that's done cravenly on purpose, or do they do it kind of by accident, as in they need to prepare things in a certain way and a lot of the sort of side effects of that are by accident?
I think that's a really profound question. So a lot of my research is now done with economists, and we can look at how financial incentives work in the food system. And what we see is that if you imagine running a food company, if you and I are both running separate food companies, for us to both stay in business, we have to do two things. You have to sell more food than me, or you can make money by cutting the price of your ingredients. And so the food companies are doing both of these things as hard as they can the whole time. The ingredients are very cheap, but food has to be engineered to be consumed to excess or beyond our appetite, because we all have an excess of calories. Even people with very low income in this country have an excess of calories available and affordable to them. And so we know that the biggest food companies use focus groups, they use teams of neuroscientists, they use MRI machines to design foods that are very hard to stop eating. So I don't think the purpose is not to do harm, but it is an inevitable consequence. Much like tobacco, the tobacco industry and the food industry from about the mid-80s to the early 2000s were the same industry. The biggest food companies were the biggest tobacco companies. And I don't think the tobacco companies wanted to give anyone lung cancer. It was just an inevitable byproduct of selling people cigarettes that contained tar and nicotine and were addictive.
Yeah, so let's get to bowel cancer and see how ultra-processed foods and what we eat might have an effect on how we get bowel cancer. So just a few facts. Around 45,000 new cases of colorectal cancer every year. It's the fourth most common cancer after breast, lung, and prostate. And most people who get bowel cancer are over the age of 50. In fact, the majority are around 70. But I guess what's been most concerning over the last year or two is the increasing evidence that we have a number, now double, nearly treble a number of younger patients under 50, young onset colorectal cancer, and there doesn't seem to be any explanation for it. It's clearly very, very worrying, and we both of us see in our experience with friends and relatives, and certainly me and patients, it's really noticeable that we are beginning to hear about, see, and know patients who are under 50. And maybe there's something in the world that's doing it, and maybe it's food.
I'm fascinated to hear you say this, because I have noticed now that among my friends, I'm 46, but over the last 5 years, I can name 5 or 6 friends who have got metastatic solid malignancy. That some of them have had colorectal cancer. One has died of colorectal cancer. But when it's a small group of people, you don't know if this is just an anomaly. So it's really interesting for me to hear that the epidemiological data that says that this is a real phenomenon is also playing out in your practice. You are actually seeing more of these patients.
Yeah, absolutely. And it would have been uncommon on an operating list to see somebody under 50. And now my colleagues are saying it's not exactly every week, but it's much, much more common than it was. And it's a bit shocking because many of these patients, of course, present late, because the story has always been bowel cancer is something you get in your 60s or 70s. And when somebody has bowel cancer symptoms, in their 40s, they think, well, it can't be that because it's a disease of old age.
So I have a bit of a dog in the fight. I've published a book on ultra-processed food. I did research on ultra-processed food. I hope I'm not conflicted, but I could be easily accused of bias. So I have had, we've got a lot of evidence we're going to discuss. I've had a feeling that it's very plausible when we look at the mechanisms. My background is as a molecular biologist. But from your perspective, one of the things that seemed very striking to me is lots of the things that I think of as being risk factors for cancers, particularly bowel cancers, have been, in some respects, improving. We've now known about fiber, fruit and vegetables for a long time. We smoke less, and presumably smoking is a risk factor.
Indeed it is.
So a lot of the things I would have guessed without having the data that colorectal cancers in under 50s would be not worsening over the last 20 years. And that's not what we're seeing. And that's why it's felt legitimate to me to go, it is worth looking at the stuff we put in the tube as at least a plausible thing that we should be considering about driving this.
Yeah, so tell us a little bit about, in general terms, we think about bowel cancer like other cancers being related to the environment and to lifestyle and to genetics. And certainly as far as bowel cancer is concerned, a major genetic influence only seems to pertain in around 20% of our patients. So the rest of them, it's all the other things. So tell us a little bit about food and lifestyle and how they might have an effect.
So it's worth explaining what ultra-processed food is, because almost everything I will say in this interview is contested, and the debate around ultra-processed food is entirely polarized around conflicts of interest. So the food industry fund a huge amount of research, directly and indirectly, saying that this is all nothing to worry about. There is an increasingly large community of independent academics. There is the World Health Organization, there is UNICEF, and there are many, many governments who say, no, ultra-processed food is a thing we should be worried about for lots of reasons. It is not an informal term, okay? It is not like junk food or fast food. It is a well-defined category of food, and it forms part of the NOVA group classification, where a team of scientists in Brazil in the early part of this century noticed that there was a paradox in diet-related disease where households that were buying more fat, salt, and sugar were healthier than households who were buying less. And the explanation for this seemed to be that the households who were buying less of the raw ingredients were still consuming a lot of fat, salt, and sugar, but they were eating it in the form of pre-packaged, industrially prepared food. All this new American food that came into South America after the free trade agreement. So they wondered if the processing of food, the stuff that companies do to the ingredients, could affect your risk of diet-related disease, of poor health outcomes, particularly obesity. So they came up with a classification, and ultra-processed food is one of the categories of food. And we now, 15 years later, have more evidence around a dietary pattern of ultra-processed food, which we have in this country. So 60% of our calories on average in the UK come from ultra-processed food. We have more evidence around this dietary pattern than around any other dietary pattern that we've ever studied. We have more evidence than we do about the Mediterranean diet or the DASH diet or any other kind of diet. And the evidence is around the dietary pattern. So ultra-processed food, the definition is 9 paragraphs long. It's really, really unwieldy if you're a scientist. But it boils down to stuff wrapped in plastic, made with ingredients that you don't usually find in a domestic kitchen. So if there are mono and diacetyl tartaric acid esters of mono and diglycerides of fatty acids, which is the emulsifier in almost all of the bread we have in the UK, that's a sign that something has been ultra-processed. And it's a way of describing the kind of products that they're convenient, they're marketed, they have intellectual property, they're branded. So some of it's obvious junk. If you go into a big fast food chain, that will almost all be ultra-processed. But it's also all of our breakfast cereals. It's all of our supermarket bread. It's most of our flavored yogurts. It's almost any product with a health claim. So if you're eating a nutrition bar for lunch, or lots of our busy colleagues will have these meal supplement drinks, that you can drink your whole meal without leaving the operating room, for example. So that's all ultra-processed. And they will be made of a small number of ingredients. They're usually made of these commodity crops. So they're made of soy, rice, wheat, corn, plus a bit of dairy, emulsified together, flavored, stabilized, and preserved. And that's the economic logic of them, is to take these very, very cheap ingredients and turn them into branded items that can be marketed. And then you can use all your flavor molecules and your cosmetic additives to make them very palatable. So that's the kind of logic of these products. And the definition wasn't created to regulate the food. The definition was created to ask this very simple question: does industrial processing affect health outcomes? And so we've used the definition now in randomized control trials, in big population studies, and then for basic scientific research.
So can I ask, it could be what's in the packet, as it were, particularly the additives, or it could be the packaging itself, because we hear about microplastics and all that kind of stuff. So it might be some of that too.
So when it comes to the epidemiology, fairly quickly, certainly by now, it's established an association. So if you eat more ultra-processed food, there's a dose-response relationship for a huge number of negative health outcomes, of which colorectal cancer is one, but it's also associated with depression, anxiety, other cancers, inflammatory bowel disease, obesity, metabolic disease, negative cardiovascular outcomes, cerebrovascular disease, dementia, and there are probably some others, chronic kidney disease. So we've now got big meta-analyses for most of those outcomes. The question is then going, is it causing it, or is it just food eaten by people who also smoke, also drink alcohol, live in poverty, live in disadvantage? So the next tier of questioning you have to do scientifically, as you know better than me, is to go, well, what are the mechanisms by which this food might drive harm? And at that point, the barrel is so full of fish, it's hard to hit the right one. So we could work from the inside out or the outside in. If we look at the thing we know about ultra-processed food, and my research group has done a lot of this work, is we know it's all very fatty, salty, sugary, and low in fiber. Perhaps not all of it, but 99% of it is excessive for fat, salt, or sugar, or deficient in fiber. So it's got a lousy nutrient profile. And when I was at medical school, these were the things we know, that if you eat fatty, salty, sugary, low fiber food, we know that's a risk factor for lots of bowel pathology. So then and I think that those ingredients are probably what drive most of the harm. The additives, if you like, are a a proxy for food that is made by an institution, usually a big transnational corporation, that doesn't care about your health. They don't prioritize this, and we can show that. But in the case of colorectal cancer, there are some additives that are really concerning. So the emulsifiers are probably the biggest category where we can go from pretty good lab research published in really good scientific journals like Nature, all the way through to big population epidemiology data. And we can tick off all those criteria, they're called the Bradford-Hill criteria, saying, is ultra-processed food or are emulsifiers really causing the problem, or are they just associated? And I think we could say, in the case of the emulsifier additives, that many of them are carcinogenic. And I think this is where I have so many questions for you about going, what do you think about this being plausible?
Can I just ask you, before we go on to that, the idea of what people call forever chemicals, as in you're in the field, you put stuff on, it's either the soya or the wheat, and then that gets into the food chain and it stays there even if it gets into the packet that you eat. Is that part of the problem too, you think?
So the emulsifiers are added to the food and they're on the ingredients list. And there are a few others that... So the emulsifiers, we'll talk about the microbiome, I'm sure. They disrupt the microbiome and do some other things.
Yeah.
Then we've got non-nutritive sweeteners. They also disrupt the microbiome. But then what isn't on your ingredients list, so you can see on a packet it will say polysorbate 80 emulsifier, aspartame, non-nutritive sweetener. What the pack won't tell you is the molecules that leach from the plastic packaging of this food, because it's almost all packaged in plastic, especially when you heat the food in the plastic container. And we now have quite a lot of evidence about the bisphenols, the phthalates, and some of the other molecules that are created during the cooking process in high temperature processes used to cook the food in the factory. And I think we have some evidence that they are broadly disruptive of biology, but also carcinogenic. And they also have these endocrine effects. So the endocrine effects, the effects on hormone systems are probably better understood. But before we started filming, you mentioned endocrine cells in the gut as being of increasing interest in colon cancer, which wasn't a thing I was aware of. So that, again, as I think different fields come together, and the endocrinologists go, we've been worried about the molecules leaching out of plastic packaging, I think the colorectal experts are going to go, whoa, we've been interested in endocrine cells in the gut.
Yeah.
Let's see if we can bring these fields together.
Yeah.
So that's one thing is what we call the migrant molecules from the plastics, but then we also have the plastics themselves. So there are, if you like, the additives to the plastics, the bisphenols, the phthalates, that cause endocrine disruption and inflammation and probably microbiota disturbances in the microbiome. But then we also are increasingly worried about the small particles of plastic that come from the plastic packaging, that come from our plastic water bottles, that may come from the plastic pipes in the street. And these have been found in almost every body tissue that's ever been inspected. Now, that's quite early science. There are lots of difficulties with the assays and how you actually measure the plastic. But I think increasingly credible, responsible scientific groups are worried about the plastics themselves as being inflammatory. So again, we're consuming particles of plastic that are going into the gut, interacting with the microbiome, probably being absorbed. Certainly the nanoplastics are being absorbed. And we know then in lab experiments, those microplastic particles are inflammatory. And I think inflammation has become a really big part of the cancer story in the last 20 years, in a way that it probably wasn't actually when I was at medical school.
Yeah, chronic low-grade inflammation as a promoter, absolutely. And we were saying earlier, I mean, what's really interesting is that the gut lining cells, particularly the colon lining cells, are turning over once a week, which is unbelievable. It's much quicker than the skin. And of course, every
these
time...
are the fastest dividing cells in the body.
Yeah, and every time a cell divides, of course, there can be a replication, a duplication, a copying error of the DNA inside the cell. So you can see how if it's turning over rapidly, there are many more opportunities for those errors inside the cell to accumulate. And we think that eventually those errors build up and then the cell becomes anarchic and becomes a cancer. But maybe we could talk about what's actually happening inside the colon. tell me a little bit about your understanding of the microbiome inside the colon.
So I think a lot more is said by doctors in the public eye about the microbiome than is known about the microbiome. Is that
I think that's fair, yeah.
I mean, so I'm an infection scientist, so I spend my life clinically destroying the microbiome in patients. I give them antibiotics and we disrupt it. It's quite a robust organ in the sense of we think we can give people antibiotics and it does recover. So I think the more important way of thinking, if I go back to basics, and I look for your correction here, Neil. The numbers are disputed and they will change with bowel habit, but you have hundreds of millions, hundreds of billions of bacteria lining probably quite a lot of the gut, but particularly the large bowel, the colon. It's the largest immune organ in the body, and it's all at once sort of part of you and not part of you. So it's essential for life. And I think of the bacteria in the colon as a sort of metabolic engine. They can digest food that we can't, so they extract probably around 10% of our calories from the fiber we eat. We can't digest fiber. We can only digest the protein and the fat and the sugar in our diet. And then the bugs digest the fiber. And in exchange for us feeding them, the way I think about it, we feed them fiber and they secrete little molecules, short-chain fatty acids, that modulate our immune system, that provide some energetic benefit to the heart and the brain, and are generally good for us in ways that we, I think, don't understand in detail. So these are things like butyrate and propionate and acetate. And the very specific way in which the bugs in our gut eat our fiber and the exact amounts of these molecules they secrete, the timing and the location they secrete them at all seem to be very, very exquisitely balanced by the gut. And there's a dialogue between these bugs and our immune system that I think we're just beginning to unpick. What we do know is that if we disrupt the microbiome, mainly with poor diet, by changing the balance of the bugs there, some of those bugs start to secrete harmful molecules, and we think some of those may be carcinogenic. They start to interfere with...
One or two bugs have been identified, haven't they?
Right,
They're in the literature suggesting this is secreting something which is directly affecting...
DNA repair.
Yeah, all that stuff.
And so they start to really interfere with the things that we, at least are adjacent to the things that we think also drive cancer, the ability of cells to repair DNA and divide. So I think of the food we put in our mouths is sort of akin to the soil we put in to a garden for the plants. Planting the right plants is probably less important than having the right soil, and then the right things will just grow, because the seeds are everywhere. We're constantly consuming bugs on our food and from the people that we live with. So the microbiome, in terms of colon cancer, I think is probably the disruption of the microbiome is one of the big mechanisms by which poor diet is linked to colon cancer. And this low-grade inflammation that you mentioned earlier, we have increasing amounts of data that an ultra-processed diet is inflammatory, that obesity is inflammatory, that an ultra-processed diet causes inflammation and obesity, so they start working in collaboration, if you like. And then components of ultra-processed food that are exclusively found in ultra-processed food, things like non-nutritive sweeteners, a lot of the gums, the emulsifiers, also cause low-grade inflammation. And some of the mouse data, I think, is very persuasive, that you can take mice, feed them emulsifiers, induce low-grade inflammation, start to see, you can measure the way that cells divide in the mice, and you start to see, I guess I would think of them as pre-cancerous changes in cell division. They start to repair themselves less. But you can then show that if you give the emulsifiers to germ-free mice, they don't cause the same effects. And then you can take the microbiome from the mice that you fed the emulsifiers that are inflamed and becoming, I guess, heading toward a sort of cancer picture. You can take their feces, put them in the germ-free mice, and then they develop the problems. So these are very elegant experiments doing that kind of very basic medical stool stuff of fulfilling Koch's postulates, where you have to sort of meticulously dissect away
one feature.
Right, exactly.
Try and make sure it's only that and nothing else, and no confounding factors. So we've got this soup. We call it the microbiome. It's our natural, partly our natural in-house defense mechanism and metabolic mechanism in the colon. And then we pour stuff in at the top end, and we can either encourage it or discourage it at our peril, as we may think. So the lining of the colon is also interesting because, as I've said, it's turning over all the time. And we now know that when you get a colon cancer, it doesn't just go, it's a colon cancer. You get these little bumps like warts in the lining of the colon. We talk about polyps. In technical terms, it's called an adenoma. And this little bump of the lining of the colon slowly gets bigger and bigger. And there are a series of genetic events that take part before it becomes what we call an invasive cancer, the polyp to cancer or the adenoma to carcinoma sequence. And what's very useful for us as both scientists and clinicians, and for everybody as a population, is that we can actually see this happening. So up until around 1985, we weren't able to look at it, but then the advent of colonoscopy, you could put a scope into the bowel and you could actually see these things. You could see the little bumps, and then you could sometimes leave them and see if after a year or so they grew bigger. You could see the different kinds of bumps, some on a little stalk, some like a rather flat one, and we began able to begin to tease out which one of those are more likely to become cancers. And so we've got lots and lots of information now about what these pre-cancer lesions look like. And I guess the future is to try and match what you've been saying about the soup in the colon and how the bugs are affected by the soup and how the bugs protect or in fact don't protect and allow that mechanism to happen and for cancers to develop.
Lifestyle's really, really interesting because I think of the mechanisms as there are sort of two types. There's the direct carcinogenic, I guess, effect of the food, whether it's the additives, the poor nutrient profile, the lack of fiber, the migrant molecules from the plastics, the microplastics. There's all of that. But then there's also the fact that the food is obesogenic. This is food engineered so that it's hard to stop consuming. We have very, very good evidence about that. It has all the properties of food that we've understood for decades does this. And that's its purpose, is for you to buy it and eat it. And obesity itself is inflammatory, and we know that obesity is a risk factor for cancer. So it's like you're getting this double jeopardy of food that's making you gain weight, and that being a risk factor for lots of cancers, including bowel cancer. But also, the food itself is disrupting the microbiome and harming the cells. I'm trying to think if there was a thing I wanted to ask you, really, about there's the microbiome living in the large bowel, but that is living in this very important layer of mucus.
Yes.
And the mucus is one of the things, it seems to me, this food, we think the food is really disrupting. So a lot of these emulsifiers are fundamentally detergents. I mean, soap is an emulsifier. And they seem to be, in simple terms, stripping out the mucus. And it's a very complex picture where, if you like, the place the bugs like to live in the mucus, which is a secreted home for the microbiome, that is being scrubbed out by the emulsifiers. So if we want to ask, how is it plausible that ultra-processed food, or foods like ultra-processed food, might be linked to colon cancer? It seems to me, just off the top of our heads, and this is still quite an early research field, you and I have come up with a lot of mechanisms that feel very legitimate. They're not wild theories. Is that fair from your perspective?
Yeah, I think it is. And I mean, coming back to the mucus idea, of course, the colon isn't just a flat surface. It's got lots of little pits. And it's down at the bottom of these pits that what are called the stem cells, the cells that make the lining, are continually doing their division and replication and then sometimes accumulating errors. And if that mucus is stripped away, then the bad things can get down into the pits and get to those stem cells. So again, here's another possible mechanism by which the bad things we eat and the bad things that are in the colon soup can actually begin to affect the process of cell division and the formation of these adenomas and these cancers in the colon.
Do we think that transit time is still important? That ability of fibre to just move stool through the gut, is that Is that an important part of reducing risk factor, reducing your risk?
Well, we always used to talk about Burkitt and fibre and so on, and I think mostly people still now eat enough fibre to not be grossly constipated. I mean, I think back then, in my early days as a surgeon, we saw lots of people with really pretty bad constipation, but I don't think that's quite so common now. I mean, certainly, if stuff is hanging around longer, then it can have more of a local effect. But I think an absolutely direct effect on the science of transit, together with the local effect of the bad things we're eating, is difficult to prove. But in general terms, probably yes.
But you think constipation, in your sort of clinical experience, you see less severe constipation?
I think
less.
I think that's got out. You know, basic fibre, yes, I think that's got out there.
Which absolutely further underlines the importance of going, if we're eating more fibre.
Yeah, quite.
And I think the messages around fruit and veg have got out there.
Yes, they have. Yeah.
What is then causing this increase in young people?
Yeah. So we've been talking earlier about this cohort of younger patients getting colorectal cancer. All the evidence suggests these are the people born in the 80s and 90s and onwards. So is the beginning of the peak incidence of the effect of ultra-processed foods from about then on? Does that kind of tie up?
If you look at US data, in the mid-1970s, men and women, black, white, Hispanic groups, all ages, everyone starts gaining weight at the same time. And we know this coincides with the introduction of mass industrial food processing into the US diet. Microwaves have been invented, everyone's got a home freezer. Now, we lagged behind the US by 5 to 10 years in terms of, it's fundamentally American food, it started coming over here. So it's our ultra-processed food consumption starts really taking off early to mid-1980s. So I think that fits really well with what you're saying. Yeah. So I was born in the late 70s, and my childhood was pretty ultra-processed. Breakfast cereals, snack bars, a lot of it's still around today. But in my childhood, we were still eating 3 meals a day, quite often of ultra-processed food. Now we're eating 5 or 6 times a day, so it's the spaces between meals that have been taken over. So we call this the snackification of the diet.
Okay.
So ultra-processed food consumption, first it took over our meals, then it took over our snack times, and now of course we can order it late at night, we can eat it before we go to bed, first thing in the morning, you can eat it at any time of day.
Okay. So what we wanted to emphasize, because it's Bowel Cancer Awareness Month, is that if you're under 50 and you have any bowel cancer symptoms, you've got to get checked out. So over the age of 50, there is now the National Bowel Cancer Screening Program. You can have a poo test. A little piece of poo is tested for microscopic amounts of blood in it, a special immuno test, which is pretty accurate. And then if it's positive, don't worry, because the next thing is you get a colonoscopy. And I'm going to ask you, Chris, have you ever had a colonoscopy?
No.
I have. I've had 2. I just want to say to everybody, it's nothing to be afraid of. The prep's pretty bad because the bowel has to be cleaned out. But actually the colonoscopy itself is, you maybe have some sedation, maybe you don't, and you can watch on a TV screen and look to see if you've got any bumps and so on.
My brother's had one, and I've seen the video of his colon.
Yeah.
It was very instructive.
Yeah.
So I'm 46.
Yep. When
should I start sending off my poop?
Well, you can't in the national scheme until you're 50.
Right, but But
if tomorrow you suddenly say, I've noticed some blood, or, do you know, I used to be very regular and now I'm going a bit all over the place, I've got some episodes of diarrhea and it's not because I've eaten anything, bit of tummy ache, or if you are suddenly found to be anemic, any of those things should really raise alarms and you should get checked out. I think part of the problem is, in the medical community, even if you went to see your GP, and this isn't for a moment knocking GPs at all, but they are used to seeing people in their 70s with colon cancer. If somebody comes along in their 40s or 30s with these symptoms, I think, well, it can't possibly be bowel cancer. What we're saying now, it definitely can be, and you must be checked out. Yep.
Great. Okay.
And if bowel cancer is found, of course, it is very, very curable. If it's caught early, 90% 5-year survival rate. That's the way in which we describe how well people do. One of the best cancers to have. And of course, minimally invasive surgery, keyhole surgery, robotic surgery. some very, very good new drugs coming along. And so the outlook is being transformed. So it's not that you shouldn't get checked in case you find you've got it and oh my God, it's going to be terrible. It's you must get checked because the earlier we find it, the better the outcome.
If you find it when it's still a bump or a little polyp and it hasn't spread, you can cure me.
Those are all snipped off at the time of the colonoscopy. And then obviously they're looked at under the microscope. We need to get to the point where we bring all these things together, Chris. What do you think about changing behaviour? Is it too late to change behaviour? I mean, there'll be 20-year-olds maybe watching this, or 30-year-olds. Should they change their behaviour if we do begin to see more and more evidence that ultra-processed food and colon cancer are related?
I've been very careful. I think it's true in the last 2-3 years where I've been quite public about ultra-processed food, I've never ever told anyone to stop eating it. And the reason for that is because the food we eat isn't really for most people a choice. It's the food that's around us, it's what our culture eats, it's what we can afford, it's what's available.
Yeah.
And so I'm very conscious, particularly if you're sort of people like us broadly, you know, someone like me, I'm educated, I have money, it's quite easy for people with resources to switch away from ultra-processed food, but it is fantastically expensive. So we know that people in the bottom 25% of households by income, it would be essentially impossible for most of them to do it. They would have to spend almost all their income on food to eat just according to our guidelines. So my interest is, I think it is important to say to people, look, what I'm prepared to do here is go, if you lived in France, the French government would advise you to eat less than 15% of your calories from ultra-processed food. The Brazilian government would say children should not eat ultra-processed food. Israel, Belgium, Canada, almost all South and Central American countries advise against the consumption of ultra-processed food. UNICEF have clear guidance, and the World Health Organization is developing metrics in order to give advice and guide policy. So this is, however much the food industry complain about this is very widely agreed on internationally. The concern in the UK is that I think we have not really understood the extent to which this is not a matter of willpower and personal responsibility, any more than cigarettes were. You know, I mean, you and I have both told patients to stop smoking, but back in the 90s when they were still being advertised cigarettes, that was an impossibility for them. Now our patients don't smoke because there are no smoking ads. I think successive governments in the UK have partnered with the food industry to develop food policy that means that bad food, never mind ultra-processed food, is very unregulated in this country. So if you go and buy a can of sugar-sweetened cola, any brand, there is nothing on that can that says it will rot your teeth, for example. And we know that tooth decay is a huge public health problem. If you go to a fast food restaurant, there's no warning on the food. There's no warning on the sugary breakfast cereals. There's no guidance about how much children should eat or the fact they don't contain enough fiber. So we don't really have good regulation around harmful food in this country. So most of my advocacy is pleading with government charities to stop partnering with the biggest food companies and think of themselves as regulators more than partners. Because we know that companies find it very hard to change direction voluntarily. They have obligations to their owners and shareholders. And behind closed doors, the food industry say to me very clearly, we can't do this unless government enforces it. So that's a slightly convoluted answer. We have good evidence. The more you reduce your intake, the lower your risk. And it's worth saying ultra-processed food is not the only harmful food. So if you live on a diet of, traditional cheese, red meat, butter, and low fiber, you could not eat much ultra-processed food, but you would still be pretty unhealthy. Yeah. So it's not the only unhealthy food, but almost all ultra-processed food is unhealthy, including the stuff that claims to be healthy.
Okay, so you heard it here. I'd like to extend a big thank you to Chris again for coming and joining us. Big thank you to the College of Surgeons for letting us shoot this here. And I hope you've enjoyed our discussion. I've certainly learnt a lot, and Chris, it's been great to chat to you again.
I haven't learned this much since I last spoke to you 20 years ago. It's very good.
Thank you.